Good afternoon. As some of you may know, I'm Michelle Berry. I'm the Dean of Global Health, and I want to welcome everyone to this event on global health storytelling and advocacy. About 10 years ago, I founded a media fellowship, really was on global health, and I believed this was a fellowship that was of great importance because I still think that physicians are very trusted members of our society and that can tell stories with great trust. I also felt that many of these untold stories needed a light really shined upon them. So I'm glad that you took the time today to spend a little bit of time to actually learn how to tell those stories. And we have an extraordinary panel that are going to help you hopefully develop those skills. So I'm going to introduce them. And I actually don't know everyone on this panel. So I'm going to, I guess you must be Dr. Alok Patel. Yes, nice to meet you. Alok is a pediatric hospitalist, journalist, host, and news correspondent. He's a medical correspondent for ABC News, hosts a bi-weekly health segment called, I love the name, Patel It Like It Is, and is a special correspondent for ABC 7 San Francisco. He co-hosts PBS's Vitals. I'm not going to ask you what vital structures those are, and was also co-host of Nova's Parentalogic. Okay, tell us what that is.
Parenting meets comedy. How else do you get people to tune in?
Got it. Really good. I like that. See, a skill. He also hosts a popular website series for Medscape. It's called The Hospital. You give great names. The Hospitalist Retort. Alok is on our faculty at the Stanford Children's Hospital and is the pediatric faculty lead for media and communication strategy. Cecilia, who I also, nice to meet you. Cecilia Aradaza is Chief Communications Officer at Stanford Medicine, where she helps craft integrated communication strategies that bring to life the organization's leadership, values, and priorities. Previously, as Executive Director of Strategy for the social impact agency Wondros, another great name, she provided communications leadership for Operation Warp Speed, a super good name, and the NIH All of Us research project. She also led communications for the Biden Cancer Initiative. Britt, who I do know very well, is an author, science communicator, and researcher working at the forefront of climate change and mental health. She just graduated from our postdoctoral fellowship in climate health and planetary health, and is now a professor, well, not a full professor, working towards being a full professor in the Department of Psychiatry. She really does amazing things. She just published a book called Generation Dread, Finding Purpose in an Age of Climate Crisis. She's hosted several podcasts, radio, TV programs with BBC, NPR, CBC. Her TED Talk on climate change and mental health has been viewed more than 2.5 million times. She is well known around the globe. Janine Zachariah. Hi, Janine. We missed you for lunch today. I'm sorry you couldn't make it. But Janine is a journalist and the Carlos Kelly McClatchy Lecturer in the Department of Communication, where she teaches news reporting and foreign correspondence. She is the co-author of How to Responsibly Report on Hacks and Disinformation. Previously, Janine reported on the Middle East and the U.S. foreign policy for close to almost 2 decades, right? Including stints as at the Jerusalem bureau chief for the Washington Post and State Department correspondent for Bloomberg News, among other accomplishments. And Christina Krohn is an internal medicine and pediatric hospitalist and soon to be associate professor at the University of Minnesota. She is a graduate of the Stanford Global Health Media Fellowship in 2013 and remains committed to teaching new generations of doctors how to communicate with the public. And as the director of online content for Minnesota's Global Medicine Program, she ensures that providers know how to care for people from very many diverse backgrounds. She also leads a course for third and fourth year medical students on strategies for communicating medicine to the lay public. She also sits on the Minnesota Medical Board. And last but not least, this outstanding panel will be moderated by Paul Costello, who previously served as Chief Communications Officer at the Stanford School of Medicine for 16 years. He's now an adjunct faculty member in the Department of Medicine and a Global Health Faculty Fellow in our Center for Innovation in Global Health. He has wonderful skills as an interviewer, and he's going to try to bring a global health perspective to how one tells a good story. Take it away, Paul.
Thanks. Thank you, Michelle. And thanks, everyone, for being here. It's nice to be with real people again, a real crowd breathing together, not on Zoom. And thank you, panel, for joining us today. This is a very peculiar time in the media. And I want to begin by asking everyone up here to reflect on this time in the media landscape. And on the one hand, it's wildly democratic. Everyone can be an editor, everyone can be a writer, everyone can be a content producer, everyone can have a podcast and put it out there in this viral world. But the flip side of that, and there is a very distinctive flip side, is fake news, disinformation. And it's never been so widespread and so widely weaponized. I read a tweet today that sort of summarized a lot of the thinking that you can read on Twitter about media. And this person said, I don't know anyone who believes they can trust the mainstream media. I think the days of the all-powerful global mainstream media are over. Really, are over. The trust is broken. So we're here today to talk about perhaps building that trust, rebuilding that trust, how to go about that trust. So let me start with you, Janine. You've been a journalist. You now teach. What does this landscape, what is it like for you? How do you interpret it? How do you tell students and people that you deal with every day how to traverse this?
First I want to say thank you for inviting me to this very important discussion. I can't really think of a more important topic coming out of the pandemic. Maybe the very day that we're ending technically the emergency, was it yesterday, today, to actually have this conversation. And I also want to say what a privilege it is for me to get to teach the Global Health Media Fellows each fall in my news reporting and writing fundamentals class. They're always stellar, and I'm so proud of them. And it's a relationship that continues. Just yesterday or 2 days ago, I got an email from Tasneem Ahmed. She has a story idea about Sudan and Egypt, and can we talk it through? And she wants to pitch it. And so it's really exciting for me to be at this intersection. Just to follow up on one thing you said there, Paul, according to the latest Gallup poll on the media that I could find in October, just 7% of Americans have a, quote, great deal of trust and confidence in the media. So there's other variations, but it gives the trust in the media is a real problem, the way we have a problem with trust in major institutions like medicine, doctors, judges, and things.
Why do you think it's collapsed?
Well, I think there's a cost to polarization that we're seeing that's being fed by a lot of different areas. When it comes to the media in particular, there's a cost to having a former president who called the news fake more than 300 times and described journalists as enemy of the people. So that's something that we're going to need to work to repair, with very little defense ever offered by any other institutions of that. I think that there's going to be work to be done there. I think it comes out of fear. I think a lot of people had a lot of fear. And I think that the democratization that you talked about in terms of the media landscape, yes, has led to a lot of wonderful new media outlets. I can go on. The 19th, there's a lot of new media. It's democratized and made everybody able to publish anything without, on the flip side, and not have to go through the rigor of working with an editor. I call it, when I give talks about this, the era of noise. I mean, basically, we are all flooded every minute, every day by way too much BS and way too much information in general. So whereas before, as you know, you had to just pick it up and you had a curated product, a product maybe, and maybe one TV show. Now we don't have the mental energy to be able to go through and say, okay, which is a trusted source, what am I going to prioritize? Am I going to listen to this podcast or am I going to listen to this person? Well, this person has a lot of followers, so maybe that, so we're learning a whole new skill set. This is coming at a time of, great cleavages in society. When unfortunately, and we're going to talk about this, I imagine, in the panel, if we want to reach people with credible information in medicine, how do we do that when everything's become a team sport now? You're either on this team or that team. If you're going to tell me something that my team's not promoting, I don't even want to listen to you. So we have to talk about solutions for that.
So what are the solutions, Alon?
Give me that question after.
Yeah.
Well, so I can, from my own vantage point, we were working on a story yesterday about the loneliness epidemic. It is truly an epidemic. And our trust in each other and our trust in our government has gone down since the 1970s. And if you look at people who are quoted in the survey, they talk about things like political pride, not being able to hear one another, and also the fact that loneliness is not just the physical separation, but also feeling alienated or you're not supported, or as you mentioned, that people just don't want to be heard. So over the past 3 years, we had this thing called a pandemic. But within that, there were also these burning conversations about reproductive rights, about gun control, about climate change, about energy, about all these things that America just pick a side on. And as a journalist, what was really hard for me to do, I forced myself to do it, was talk to people who I did not agree with at all, and not actually debate them, just listen. And what I found was that there was some commonality in what we were striving for. Maybe it was just to take care of our kids or to save money. But what people wanted was transparency. And when we don't put that forward, when we don't tell people, here are my citations, here's where I arrived at this thesis, we lose them. Whether or not that's fair. And I am by no means as experienced in journalism as anyone else is on this panel. The one thing I learned from my professors, from my mentors in journalism, is you have to put that information front and center at the tip top. Because people will see titles and they'll scroll right by them and they'll retweet them. And they'll say, this is why vaccines cause X, Y, and Z. This is why Moderna is evil. And so you should actually read the study. You actually see that the data came from a blog that somebody wrote. And you mentioned this thing about non-peer reviewed or journals that just showed up without anyone editing. Hopefully no one from Moderna is listening to this call and they're just stuck. If they are, I don't really care. Because I said to their board, I said, you've got to stop having your CEO show up on television, talk about non-peer reviewed data, and watch the United States see your stock price go up. I trust the vaccines, but the other part of the population who thinks you're doing it for money, we're feeding conspiracy theories. And so I think one thing I've really learned in terms of proposed solution, aside from making everything really funny and entertaining, which I stand by, you have to have data up in front, center. Here's the information, make an educated opinion.
One of the things that you said that I've read was that we need personality in telling medical and health stories. What does that mean? We need personality.
I mean, we need relatability. We need to be, as content creators, as writers, as people who are hosting shows, who want to contribute to communication. Think about the content you consume. Think about if you're scrolling through your phone on Caltrain, like I will be in about an hour. You're looking through Instagram, or you're looking through Twitter, or your BuzzFeed, or whatever it may be. What excites you about that story? What pulls you in? Those are the pearls that I take with me when I go and I write. And some people might say, oh, well, you must read Gemma. And I was like, I'm talking about Jackass, John Oliver, Tosh.0, Entourage, like these shows that actually captivate me for whatever reason it may be. We used an example from The Marvelous Mrs. Maisel when it came to filming a PSA. So anything that pulls you in, I think is something that you can use as a tool to relate to others.
Britta, how about you? How do you see this current landscape? You approach it from several points. And one is you've written an amazing book that grabbed the center of this moment, which is on health and mental health, which is on climate change and anxiety that so many people are feeling today, especially young people. So you've put together, I was thinking about it when I was driving over here. You sort of smashed through mainstream media in a way by the books that you're doing. So how do you see this moment?
That's very kind of you. I think that based on what Alok is saying, we do need to pick up on those pearls of entertainment. We need to understand that we can't go out as science communicators and just embrace a topic that is boring. That might feel a lot like broccoli, thing that's good to eat, that we feel we might need to do in order to advance a certain public health message. But we can be savvier than that. We can think about the good elements of the story, of character, ways of being vulnerable ourselves as scientists, communicators, ways of sharing stories that might allow for people to connect with us on a deeper heart level. And while that hasn't typically been regarded as okay within buttoned-up academia, where we take the subjectivity out of things, I think that it's far beyond the time where we need to shake up how we are reaching people by understanding that ways in which we are having a spoiled media ecosystem right now, which are pulling off of emotions. For instance, yeah, we have millions of pieces of content every second being uploaded in multiple languages. We've never had to deal with this kind of confusion, as you've mentioned, Janine, before. A distracted mind is an unhappy mind. We're all distracted on the internet all day. And we see that, yes, bots are out there and they are amplifying messages that are of poor quality, but also of truthful quality. It's not the bots that are spreading and amplifying the fake news as much as it is humans who are reacting when we do content analysis and we see research that looks at what is being spread by humans faster. It's always the fake news rather than the truth, because it evokes feelings of novelty, surprise, disgust, shock, anger, fear. And we need to be able to counteract that also with an emotionally intelligent response, things that will move people on a deeper human level when upholding credible information. And it is time and appropriate as scientific communicators to ask the public to, hey, not retweet this headline just because it's catchy. Read the article and also be able to check and scrutinize the credible sources. Who's doing the study? Who's funding the study? And importantly, ways of analyzing the data. You can talk about sample sizes, for instance. All of that is fair and appropriate to have a conversation with our audiences around. We also need to be empathetic. We need to listen. We need to understand that people are not trying to be jerks and just spread bad information around and pollute our political discourse and tatter our democracies. They're actually concerned based on bad information that they receive. And so how can we be open to hearing that and having a dialogue rather than just this deficit of one-way information sharing, expecting public to take up the information like they're empty vessels that will just absorb it, such as a sponge, and then act on it in the right way. So moving towards deep listening, like I think we're getting at, empathy, vulnerability, will help us have a deeper conversation, or hopefully come to some unity rather than just wandering into polarization. And I think that that's the approach I try to take.
Cecilia, how do you see it? You're the head of a major news organization, science writers here at Stanford Healthcare. So how do you see this moment, and how is this moment in your mind and among your staff ever changing?
So much, Colin. Thrilled to be here. Hello, everyone. It is, when you say media landscape, sometimes I have this vision of like a very serene, windows, almost like kind of moment, right? He is nothing like that. At this point, it's like this box that is just so full of energy and so full of random energy that how do we then, so we can try to spend so much time understanding it, deciphering it, figuring out how to rise above the din, while at this same time kind of trying to figure out, okay, how do we channel all of this energy so that it takes, I'm thinking of like escape velocity. How do you kind of give it enough energy so that you take it to a whole nother level of conversation that the world almost needs to see? I feel like for too long, media has been on a pedestal. It's information coming from afar, coming from experts, telling you what to do. And what Rick just said, it's all about relatability. It's all about being able to meet people where they are. But the media structures, as we have them, didn't allow for that. So people took it upon themselves to create content on their own terms. And this is now where we're in this like dynamic nature. So as Stanford Medicine, as experts in this field, as a trusted brand for all intents and purposes, what role do we play harnessing that energy to then direct it to that next level of conversation, right? And part of that is one, we not only get to build trust, but we get to redefine
Redefine the terms of
engagement. When we, it's the next level of media literacy. We have to not only, provide the data sources, but also share the why. Why does it matter? People didn't even think to look at data. They listened to people that their cousin trusted and quoted. And so being able to articulate the why in terms of why it matters to people as opposed to why it matters to the expert, I think is going to be the responsibility we as a collective community need to really own and enjoy. Because it's a moment where, it's absolutely daunting when you think about where we are, but it's also quite an opportunity, and never have we ever seen this much level of engagement. I mean, at the very least, people are talking. They're looking for connection. We either get scared of that or we go jump in there and figure out how do we harness that? And that's what we attempt to do from a Stanford medicine standpoint. We welcome every opportunity to work with our faculty and really, not add to the noise. It is the era of noise. But how do we try to
Do you like that the editor is largely gone now? Do you, as a manager, as a person who controls message, do you like that, it's flat?
I would say I don't think it's necessarily fun. I think the edit, I think those that stay the course and actually stay, stay true to the core of communication and keep the editorial. It may not look like the editor of 20 years ago, but there is absolutely editorial process is the check and balance that needs to be in place to be able to tell the story the right way and make sure that it gets to the right audience. I think it's no longer a kind of check the box aspect, but it's a much more engaged process of now not just about publishing a piece, but it's making sure it's getting to the audience's feet. So sometimes it's about not getting it published, but giving it to the right person. So I think it's a much more engaged process. Rules are being redefined as we speak, and people are watching all of us as we redefine those. So I think there's a really higher level of accountability.
Christina, when we were talking several weeks ago, you said something that stuck in my brain, and we were talking about global communications, global media, et cetera, and reaching them. And you said, there's not a lot of words that make you speak, I think, 7 languages. There's not a lot of words in English that translate into other languages when you're talking about healthcare, you're talking about medicine, et cetera. So how should someone who's trying to reach a global media audience think of that and walk into that?
I think one of the big things that everyone here does excellent work that reaches so many people. And globally, often the best way to reach people isn't to reach them globally, to reach them locally, do it through their language, through their means of expression, whatever is appropriate wherever you are. I come from rural Minnesota. That's quite a different feel than here, you might guess. And that's really important. If you're trying to tell a medical story and you're talking about hypertension, and there is no word for hypertension in the local language, you have to find a way to describe it. If you're talking about diabetes, lots of languages don't have a word for diabetes, but they do have a word for sugar. You end up talking about high sugar. And then that becomes part of the story too, making sure you're really utilizing the language.
I want to ask you all about. I'm sorry.
I just want to know what the language.
Oh, go ahead. Go ahead.
I speak English generally. Okay.
Yeah.
I'm all right at it. I speak German. I've learned Portuguese and Spanish. I learned a little French, but it's like rusty.
And Lao.
And then I speak. Once upon a time, I learned Uganda, but I mostly.
When I got off the phone with Christina, I put my head under, the desk and said, "You don't speak anything, you idiot." Another question I want to raise with each of you was when Tony Fauci was leaving government a few weeks ago, leaving the NIH, he gave a series of interviews. And a common theme was his belief that researchers and healthcare professionals need to push back more. And they need to push back aggressively against fake news and disinformation. And on Sunday, I was looking at a Twitter feed of Peter Hotez, who is a noted virologist at Children's Hospital in Houston, a vaccine scientist, and a noted international global health person. And what struck me was the amount of hate fired back at his somewhat innocuous Twitter feeds and tweets. And so it made me think of, how do we convince people, to take what Tony Fauci says, be more aggressive locally, internationally, globally, when they say, why should I do it? Why should I put myself out there and get hammered? Why should I put myself out there and continually get hit with vitriol? So Janine, what would you tell people about that fight, that argument, getting engaged?
It's a very important question. I think that, this is a problem that affects first of all, I think Twitter's over. I think we're moving on. I can't be on Twitter, given Elon Musk. It's monstrous what he's doing to journalists, to people. I mean, and it can go on. That's a separate thing. So I'm waiting for the next Twitter, Blue Sky or whatever he's going to do. But the whole idea that there were content moderators that were there to try and keep people safe online. That's all gone at Twitter. So I don't think that's a safe space to engage for medical professionals right now, as bad as it is. But that's an aside. I think I was asked by a sports team on campus to do can you guide the team on how to deal with like hate online? And it was really sad for me, right? And what I said to them was
A sports team.
is getting
hated.
Yeah. So they were upset. And I said, if someone yells at you while you're running down the court and they say, you suck, so and so, are you gonna stop in the middle of your match and yell back at them? No, you're gonna finish your play, right? And so I think it's important to remember that you do not owe a response to every Yahoo on the internet. You do not owe a response to someone who sends you a hate message. There's something called the delete key. And you can delete, archive, get it out of now that doesn't mean it doesn't take a mental toll on you. And there are a lot of psychological resources about how to find allyship, how to deal with when you get, it's dark. When I used to cover the Middle East, that wasn't a picnic, but it was quaint back in those days because I would get an email, someone, telling me, oh, you're a Zionist, you're anti-Zionist, you're this, you're that, you're that. It was very quaint. And so sometimes I would say, thank you for your feedback, which could disarm a person for the reason that Alok said. It's like, oh, there's a person there. So with social media, you could choose to do that. Now, I think you want to think about what's the purpose here. So Peter Hotez, he's fighting, Hotez, right? How do you say his last name?
Peter Hotez.
Hotez, he's fighting the good fight.
By the way, it's coming next week.
He's fighting the good fight, and there's a toll, I'm sure, for him. And there's a toll for any public figure. That's what I'm saying. We can't even, it's ridiculous, but that unfortunately is the world we live in. I have to worry about my young journalists that I'm training, that they're going in now. This is part of my curriculum now. So I think though, it is important. I think it's important to be deliberate and strategic in where you post, what you post, how you post, and you don't think you have to respond to everything. So I mean, that's my main point. One thing I just wanted to add, something that's silly quickly, was, if you're a communications person 15 years ago, 20 years ago, you want to get a piece on 60 Minutes. You're working with the journalists. Not everybody's a content creator. Think about how many people said content creation. It's a big shift, I just wanted to note, and I think also, I worry about the cost of it too, though, because I don't have enough time to listen to so many podcasts, and so I'm always worried about missing all this amazing material. So I think if I'm in health communication, I'm thinking, how do I hit the most people at once? Now, the caveat to that is, are you going to be like Sanjay and go on Joe Rogan, which has 11 million listeners, and be subject to that kind of abuse, right? From that audience, you know what I mean? Who is the audience? How much are you willing to take as a toll personally?
Would you recommend that? Do you think that's a wise
Sanjay said, and I don't know if you talked to him about it a lot after he went on Sanjay Gupta, he wrote about it. After he went on Joe Rogan, he wrote about why he went on Joe Rogan. At first I was like, he should not go on Joe Rogan. I was like, not go on Joe Rogan. I don't want to go on a show. I want to go be I want to reach a lot of people, but I don't want to go on that show. He said, even if I changed a few minds on vaccines, it was worth it. So there's that. But look, what's the most watched show on cable news right now? Does anybody know? It's The Five on Fox News. The Five. This show, The Five. Take a look at that show and tell me if you want to go on to try and have a serious health conversation.
This is one that I really want to respond to, because not all of us are going to be sounding but when I teach, everyone I teach is a health professional. Everyone is a physician or will be a physician shortly. And we all do have a role. Peter is amazing. And part of why he does what he does is that he's supported by others of us. We respect the work that is done, and we talk about it, and we share it, and we do what we can for each other when we see someone doing really good work in that way on our behalf. And it doesn't mean that all of us are going to be excellent journalists. when I teach my medical students, I teach all of them. Just like in somebody goes on to be a gastroenterologist and perform endoscopies, not everybody needs to perform endoscopy when they're done with med school, but everybody needs to know when it's appropriate and when to refer someone there. So everyone as a physician should know when it's appropriate to try and get a message out there and how to support our colleagues.
Cecilia, you must have faculty come to you, researchers come to you and say, I want to get into this social media thing. How do I do it? And should I do it? And how should I devote my time to it? What do you tell people?
We're lucky when they and have that conversation. It's really to your question. It's a lot of it is sometimes the best way to push back, the most effective way to push back is not to push back at all, not to give it air, because you don't want to give it the credibility that you as an expert, you as a physician, you as the trusted voice joining a conversation that is kind of completely out there. You're giving, it's mission accomplished for that, whether it's an entity or whatever the case might be. There are very effective ways to push back in terms of the best way to do it is do the work in be the expert, lead by example, find these moments where your work can really shine. And again, you don't have to be part of the larger conversation to change that conversation. Sometimes it's easier to do it from the outside in. Be that outside voice, the satellite that kind of shakes up things, but not be part of it. So it's a lot of times when we do come, or when we work with our faculty, or when we work with so many experts throughout Stanford Medicine, it's a matter of you go back to basics. What are you trying to say? Who do you use this? And to what end? And what are our goals? Because all of these are mechanisms to deliver a message. There are means to an end. Let's talk about the objective.
Logan, go ahead.
I have so many minds about this.
It's
My
not an
goodness.
easy question.
Yeah, no, it's not an easy question. I feel that as science communicators, we have a responsibility to demonstrate integrity in time when so much is at stake around this agora in which we are all discussing from scientific advancement, what we should do in our society, how we should take care of one another. Our democracies are at stake, public health is at stake, mental health and well-being is at stake. And when we do not step into our role, step into the ring and make ourselves open to the potential harm that we will be inflicted by as individuals stepping into that ring, we do make a choice to then partake in institutional betrayal, right? We are not then being the courageous actors who act with that integrity that we understand is part of creating communities of care based on acting on good information that goes against bad actors, against the Joe Rogans who want to rip us apart, whatever. At the same time, we need teams of support, like you mentioned. It's not that those who are communicating with all the big follower accounts are doing this without an army of people behind them who are taking care of business when they're then out there demonstrating their good voice in public. Historically in science communication back in the 70s, this was called the Carl Sagan effect. That you would be judged negatively as a scientist who would go out and talk to the media because you must not be a very good researcher if you're spending all that time talking to regular folk and journalists, right? But times have really changed, and we need to also create institutional incentives to allow good scientists to go out and do this work beyond the publish or perish model that will keep them chained to their desk, writing grant applications and just thinking about their publication list. So how do we have a healthy dialogue? How do we support those who are doing it? Maybe we need to give them a mental health day every now and then to deal with the abuse that they get. Hot tip though, when you do get hate mail, you can flag it, put it into a folder called OPP, Other People's Problems, and you just let it marinate there because people are bringing their own issues when they bother to write.
How much hate mail have you gotten from your writing about climate change and mental health?
Fair bit. You can imagine climate change being the topic that it has been, particularly the debate in this country for many decades.
And so how do you go about, do you respond? Do you just put it in that other file?
To Janine's point, heck no, not anymore. I used to. Certain pieces could come in and ruin my day, absolutely. Or some, really maligned person would start making hate videos about me and putting them on YouTube. That kind of stuff is deleterious, right? So don't give it much time. What you pay attention to grows, right? And so don't pay attention to it. And know that for every negative use, you're also supported by many more. And just continue on with that because it's highly imperfect in this society and price of polarization and distrust. You're gonna get affected.
Luke, how have you been a target? Have you been a target?
Across the spectrum. So we've gotten death threats and cyber threats, and I've got a lot of hate mail. I've had memes made about me, like really fun things. One meme made about me, it had a picture of me stolen from the hospital, and it said, supports vaccines, knows nothing about heavy metal toxicity. And my mentors were like, do not respond, it's going viral. It was on, the Instagram handle was called Vegan Takeover. And I responded, and I said, next time, take a picture with better lighting. And it threw them off. They're like, why is he mad? And so one thing that I advise people if they start to get this is think about your style of response if you even want to. And you think about, are you reactive or are you proactive? Because I know examples of both. I know people who are very reactive to the news. They will instantly post videos or write articles reacting to something. That is where you're going to get a lot of vitriol. You're going to get a lot of people on both sides. Then you think about, do I want to take the time to respond to them or do I want to have no comments at all? There are people who are specialists in their field, like climate change, for example, and will be proactive. They'll put good information out there to reach people before the misinformation comes around. And if you're putting content out there, if you're writing, if you're creating with integrity and for the right reason, it's a lot harder to get rattled. And people push you aside and say, you know what, I don't want to do this anymore because I'm getting hate mail. Tucker Carlson last year, you guys probably know who this individual is, said that masks are child abuse. You should call CPS if you see someone wearing one. I made a post about it because that is ridiculous. We see actual child abuse that drops straight to the hospital. And I had so many comments. People disagreeing with me, and I literally took 2 weeks and went one by one and dismantled hundreds of them because how angry I was. I chose to do that for that one specific post. That's why I would say if you are going to take on a topic that would likely cause a ruckus from another side, is to make sure you think about where am I in this? Is it actually worth me attacking someone who may not change their mind? Or do I want to reach the people in the middle, the people who are hesitant, who are still forming an opinion? A good example of that is we made a huge mistake over the past 20 years in the 90s and early 2000s. We're saying you're either pro-vaccine or you're anti-vaccine, when in reality, the majority of people are vaccine hesitant and do not want to be labeled as anti-vaccine when we lose them. Last point, someone left a voicemail for me, Children's Hospital, and said, dear Dr. Patel, F you. True story. But an article I wrote about why gender reveal parties, not even named properly, are archaic and why they shouldn't exist anymore. Someone was very mad about it. And so when that situation arises, if and when, it's also a good idea to talk to your institution. Talk to them for support, let them know what you're doing so that they have your back if something like that does arise.
When I got nasty phone calls, I would call people back and I would say, do you know that someone's using your name to call me and say mean things? And they would go, it would be cheaper. And I want to talk about another era that we're entering into that's at the nascent stage, and that is AI. And, you know, if you read in the popular press today, it's quite dire on the one hand. And on the other hand, it's quite exploratory and quite sort of, you know, there may be some great changes in healthcare, you know, the diagnostic ability of AI. But I would say that mostly AI is getting trashed because of the fears of uncontrol. And what are they going to do at the federal level? How are they going to control it? And on Sunday, I was looking at a Twitter feed, and I was again thinking, or I was thinking of a quote that a New York Times reporter wrote who covers AI, and he said, I wonder if for the rest of our lives from now on, we're going to be experiencing future shock. And future shock was the word that Alvin Toffler, who wrote a great book about the future, he coined the term that too much is going to happen to us too quickly. So we're really at the beginning stage, and we don't know where this animal, this beast is going to go and how it's going to take us and how it's going to continue, maybe perhaps create more disinformation, more fake news. So Janine, you and I spoke about it briefly on the phone. We talked a few weeks ago. What are your thoughts about it, and how do you talk about it as a problem, as an opportunity, as both?
I mean, we need to bring the people from HAI over for, for this conversation, I think. I'm not worried about it yet too much. I just had somebody in my class yesterday who was doing a sort of tutorial on how to verify user-generated content. And so if you have to report remotely on a place you can't be there, how do you verify that that image was actually taken? That kind of very basic things. And they're not seeing it yet in the places like the BBC and stuff. There's not a ton of that kind of manipulation yet. Of course, it's happening, and it's going to happen. So I think the most important thing, if I think about this as a novice in this area, is to develop the detection tools so that we'll be able to identify what is and what isn't fake. Now, in terms of journalism, this is chaos right now. There was something at the Computer History Museum the other day with a panel, and they were like, they couldn't agree on one sentence about this. So this is all a very nascent conversation. But if I had to guess, some of the rudimentary routine stories are going to be automated. I still am going to have jobs for my students to place them in. And that AI, we have to look for ways to use to benefit us in terms of helping find blind spots in our reporting, figuring out, okay, what are the main trends that I should be reporting on, things like that, story suggestion, headline generation, positives. But I do believe that people are still going to need to report and write and do storytelling. And, I don't know, there's another theory though that we're all just going to become AI fact checkers. They're going to generate the stories. So I don't know, I'm not ready to worry about that. I have so many other things fall down right now. Like my list is so long.
That's lower. That's lower.
Let me worry
on the
about
list.
my 2022 or 23.
Cecilia, what are you thinking about in the future as you run a news operation and you have greatest quality of science writers of any academic institution in America? I might say that.
Here, here.
What are you thinking about AI?
So a couple things, I'm trying to organize my thoughts, and if ChatGPT were here, I could get some help. So I think point being, we can be afraid of it, I am. So it's daunting, but we can also use it to our advantage. We don't really have a choice, whether we like it or not. So one, we gotta understand what it is and how we use it. From a communication standpoint, we have tremendous science writers, and there is no way that, there's no replacing that. But someone once that we talked about this actually a couple of hours ago as a team, and I'm like, what should I say about AI? And it goes back to a science writer who knows how to use AI is always going to be better than a science writer who doesn't. And so robots are not going to take over. That's not going to happen. It's artificial for a reason. Wisdom, kind of a point of view, perspective, real life examples, those will always rise above. But we have to be smart about when to use it. And if anything, I feel like if you use AI to your advantage, it's your forever first draft. You know how long it takes us to get to that first draft? So imagine if that first draft was written for you, and then you get to go beyond kind of the framing of something, and you just dive right into the substance. There's a lot of opportunity here for original content. It's a moment where you can really rise above if you have something. Otherwise, it's just.
Christina, what are you thinking about it?
I would love to not have to write them. But I would like them next year. So there's that. One of the big things is how do you know what's real and what's not? And so one of the classes in my course is identifying bias and misinformation. So one of the questions is, can you identify the source when it comes to ChatGPT or AI? How reliable is the information that you're getting from it? And that is going to depend on a whole lot of different factors. I haven't figured out how exactly I'm going to teach that this coming year. Hopefully there will be more data or more information for me to use by that point in time. But definitely something that knowing your source is always going to be one of the main keys for identifying truthful information. And it just makes that more difficult.
But I wonder how much bad information are we all going to be chasing because of the rapidity of how rapid news happens today. As you all know, you do a phone call or you do an email with a reporter, and 2 seconds later, it's on social media, quote something. And the ability of AI to distort, the ability of AI to disinform, the ability of AI to spread malicious sort of thoughts and, data, et cetera. How can we prepare and how can we fight that?
If I knew the answer to that, I would already be on. That being said, it is definitely one where a lot of the general techniques about trying to identify misinformation should be applied, try to know your source, those sort of things. But health journalism as a whole, a story is most likely to be interesting and wanting to be clicked on. By definition, we're more likely to find something in the peer-reviewed literature as newsworthy because it's different than the peer-reviewed literature. So it's by definition not in concordance with the vast majority of scientific knowledge in that subject. And then that's newsworthy, and then it's different, and that makes it more newsworthy, more likely to be clickbait. And AI is going to run with that. I don't have a solution for that. I just have that it's going to become more of a problem rather than less.
Hello, Britt, how do you think of it? And how do you put it in perspective?
I think it's one of the challenging issues of our time. And it just outlines why my #1 request for regulation on these tools is for transparency. First and foremost, we have research that shows that we have an anthropogenic bias. We are not as wowed, as awed, as interested in content, in artworks, in music, and texts created by AI when we understand that it has been generated by these tools, which is good because it highlights human-to-human relevance, which for all the fear-mongering seems to be what people are most afraid of, is us losing our relevance in this game of life. And so by being able to regulate and clarify, first and foremost, that nutrition label, so to speak, on the material and the content that's being authored by one of these natural language processing models or what have you, that can help us orient in a time of mass confusion and distraction. And remember, we don't need to be convinced of a particular form of propaganda in order for our society to deteriorate in certain ways. We just need to have enough doubt be seated in the landscape of what we're thinking about, enough alternative views to question what is otherwise credible. And so if I were a regulator, that is just the #1 place in which I would be thinking about implementing. And of course, I don't know the answer, just like you, but that is where I'm hoping that people are going to be able to get somewhat in front of this before too long.
Well, what do you think? How do you think that AI will potentially change the broadcast industry that you're a part of? What is the business thinking of? How are they thinking of AI in the future? What potential strengths or damage?
I'll be quick and I'll talk about both businesses, media and in the hospital. So with media, it's a lot of what you've heard on the stage. It's things about, this could be a 24/7 free intern who doesn't whine and does all the research for us and will generate articles and will tell us exactly how to explain some pathophysiology so that I can then immediately have it at my access for reference notes for an interview, for example. I could use it in that sense. I don't think AI as of right now is going to stifle creativity. And I do not think there's no human element. As of right now, until we're in some weird sci-fi movie, when AI can all of a sudden take on a personality, which who knows, that could happen one day. One thing that is reassuring to me is if you play around with some of these chats over ChatGPT and you try to make it nefarious, it'll actually block you. It will not use racism, discriminatory profanity, anything like that. It'll actually immediately say that it's not. And I hope that stays. I hope some bad actors don't show up. One thing that did sadden me now transitioning move to the hospital side is I played around a lot with ChatGPT in the hospital for articles, for reporting, and for fun. And I put a prompt in front of a parent because the parent was asking how much X-ray or how much radiation is in this X-ray. You compare it to something like taking flights. And I was like, well, let's use ChatGPT. The answer was brilliant. And I agreed with it. And it basically showed how many X-rays it would take to equal one cross-country flight. But ChatGPT made up the citations. I was so sad. I was like, these aren't real. These citations are all false. But there's other great ways we can use ChatGPT right now. There are examples of people using it to write pre-authorizations for health insurers, which is a huge. Those are a waste of space. Different panel, that'll be like 7 days long. But amazing tool there. I use it to write inhaler instructions for a school nurse in Spanish, and it churned it out. There are ways we can use ChatGPT and AI. There's also, we use AI as a very broad term. There's AI applications when it comes to sepsis detection, when it comes to reading x-rays. So there's a lot we need to do. There's a lot of quality control. But I think as of right now, there are ways we can use it to fill the gaps that we have in so many different sectors.
I'm going to close this portion in a minute, but I want to ask the final question of everyone here. And that is, what do you think we've learned about communications on a global level coming out of the pandemic? Are there any things that strike you of, of communications, what we've learned or what we didn't learn or mistakes we've made or what we should have done? What do you think, Brett?
I think that scientists did not do the best job of being open, empathetic, clear, and helping the public understand that evidence is emerging. And we cannot immediately tell you exactly what needs to be done. Understanding your anxiety response is crucial data to be able to act in a swift fashion. However, that's not the way that science, which is time consuming and that accrues and is often kind of ambiguous in the processes by which it's being made across global teams and things like that, happens, especially in a global emergency. And so the frustration that came from that, and also the too quick impulses of some scientific voices to make declarative statements, when then later other information became available that actually created the guidelines that we needed to follow, but then had already planted the suspicion around, let's say, mask mandate. That obviously got us into a lot of difficult terrain. So I think that part of the takeaway for me is how important that human element of being empathetic to this understanding. We also have research to show that when you are empathetic to the fact that social distancing regulations have a negative impact on people's lifestyle, and if you just bring that into the way that you are talking and storytelling, that people will then be more likely to follow the guidelines when they feel understood, heard, and stood with, rather than just bulldozed over by some expert with a guideline.
Did you find yourself often watching a press conference or watching some, information about the virus, about the pandemic, et cetera, and be shaking your head and wanting to throw a shoe at the TV and say, stop, stop, stop? Did you often find that?
All the time. I had only one shoe on.
Yeah.
Just constant. Yes. Yeah, it was a regular frustration also. But then who didn't also experience some kind of fatigue from pandemic communications at a certain point, and staying with the trouble of that process of news information in a global emergency? I saw a lot of people coping by just turning away from the news, which is another challenge to deal with. How do you keep people engaged when they otherwise are feeling like overwhelming? They can't navigate it.
Cecilia, someone who was under the gun 24/7 for a long time, what do you think as you look back in this?
The fatigue is real. So I think we go back to, I said this earlier, but we go back to the relationships are primary. Go back to the data, the evidence that we have, present it in a way that makes sense. Present it with your point about empathy, making sure that people can see them, like when you're providing critical information where consequences are measured in life or death outcomes, and yet you say it in a way from a pedestal, there's no rhyme and reason around that. So if there's one who's learning, it's like you need a lot of the scientific information, but we need it from at a very human level. So storytelling at its core, we started with the idea of storytelling and how do you make sure that you transcend expectations, you transcend boundaries, and you transcend people's expectations and make it useful, like make it practical, make it real, especially during the pandemic when everything's just, the more you can provide actionable information in a way that resonates with people, it seems so basic, and yet it's so difficult to do from that. So the more we continue to go back to it, and remind ourselves, this is, at the end of the day, we don't need to overthink. Very core.
Stan, what have you thought about coming out of the pandemic?
So in addition to it taking approximately 7 seconds for the average doctor to interrupt their patient, it takes about 30 seconds for the patient to determine whether or not they can sit up. And that actually has substantial influence on and outcome. taking the medication you recommend or going to that follow-up. And I think returning to who is the trusted messenger, that's a really important question. Where I grew up, it's not somebody from the big city that I currently live in. It's gotta be someone local. So can you get that information to someone who can be trusted by that group? Can you do that in a widespread, disseminated way with all the different groups in our country? Until we answer that question, we're not gonna reach it.
Hello?
Oh, man. I totally agree with the fact that scientists came out a little too definitive in the very beginning, making statements such as school closures will not harm children. We've not done a long-term trial on that. We can't say that. We can say as of right now, we don't, but they will. This is what's best. It needed to have a little bit more substance there. So we recognize the fact that this is actually, as of right now, with the benefits outweigh the risks. We also heard scientists saying the vaccine will block transmission of the virus. That was never actually proven in any trial. It actually greatly reduces your risk of disease, which is a different metric. So when it was found out that it still can cause you to get transmission, people said, well, hey, you lied, the vaccine doesn't work. So I think being cognizant of how we're using words and the fact that people will hold on to them was a big learning lesson. February 2020, I did an interview with Anderson Cooper. At the time, Dr. Fauci and the Surgeon General and many others said, we don't need to wear masks. There's a shortage, they don't work, doesn't matter. I said the same thing. I was roasted for 2 years after that. They used the message didn't work. And I was like, it was February 2020. Like, everyone calm down. But we need to be very careful about how we word things. And another thing I'll say is, since for about 5 decades, public health agencies in this country have talked about social determinants of health. And your zip code matters so much about your ability to live a healthy and productive life. And just now we caught on to that during the pandemic, did not pay enough attention to it. At the very beginning, when it came to messaging, when it came to empathy, relatability, cultural competency, and resources. One very basic example is people saying, well, talk to your doctor if you have symptoms of COVID-19. I'm like, cool, 40 million people don't have insurance. What are they gonna do? Also, does it make any sense to shut down or close a playground around government housing and schooling and tell people, hey, go outside and play with your children? Inside of large families is not safe. We saw a lot of mixed messaging, which did not cater to our vast population, not only domestically and globally. So I think, unfortunately, there will be another pandemic, there will be another public health crisis. There's another topic happening today and tomorrow that needs to reach a diverse population, and we have to keep these cornerstones. The fact that when we talk to people, there's different religions, beliefs, political values, socioeconomics, colors of skin, there's different things we have to reach. And if you're not the person, awesome, find a representative in that community.
No, I think that was good. Oh, that goes well.
Okay, thank you everyone for a great panel, and now we're going to open it. Go ahead, Michelle is coming up, and I think we're going to open for questions from you in the audience.
Oh, okay, we're opening for questions in the audience, but I do want to say one thing. I wanted to thank all the panelists, but I really want to thank Jamie Hansen, who put together this panel. And I'll let you moderate. Questions from the audience?
Questions from the audience.
Don't be shy.
You've got questions. Don't be afraid. Step forward first. Over here. 2 questions over here.
Hi, thank you so much for such an awesome panel and conversation. I was just wondering, as individuals who have kind of like been part of so many different, I guess, journalistic endeavors, what would you say is like the most like profound thing about healthcare and scientific journalism that kind of makes it stick out against the other types of journalism? What is it about scientific and healthcare journalism that you think is probably the most striking feature about that?
Who wants to attack that? Right? I see you sort of nodding.
It's a really good question. I think the fact that the healthcare voice is the most trusted voice in society is a really interesting element that jumps out there when you're doing communication about it. I would invite reflections from others though, because I have only recently started doing healthcare communication. I've been doing emerging technology most of my journalism. So anyone want to?
What do you think, Cecilia, of that?
Well, I think from a, I said this earlier, when the accountability is real, right? Like, when there's misinformation, the consequences are life or death outcomes. Not to be dramatic about it, but true, and we've seen it. So I think the responsibility is greater. Whatever the Spider-Man quote is, like, with great power comes great responsibility, and I think that is true for healthcare.
Hello?
Yours are to healthcare.
You said fun, right? And in your question, so I will tell you what makes it fun for me. Is there is a great need for integrity and storytelling, but as far as fun goes, what captivates me is the fact that you can have the exact same condition, and depending on who you're talking to and what situation, you're gonna get a completely different life story. So I did a story about diabetes on the border of Texas and Mexico, PBS NewsHour, and it was mind blowing how high the rates are there and what they're still doing, even if they don't have transportation to manage their blood sugar. We did a story for PBS about sex in elderhood. And people were like, what? Why are you talking about that? And I was like, go talk to the population. And for that population, it was so important to have their story told. So there is something that we're continuously learning. If you already know everything there is to know about the pathophysiology and treatment of this disease, talking to people and their cultural experiences with it there's never a dull moment. You should go into it, by the way.
Yes, I have a question about communicating on climate change. And so, beginning, we opened up with talking about data and how important it is, but then there's this other side of the coin that is you can't over communicate about data, or people won't listen or check it out. So how do you strike that balance when you're trying to educate and advocate and change people's minds, but you don't want to turn away by putting all the numbers in data?
Yeah, it's a really important question. And for so long, we have been talking about the climate crisis in terms of gigatons and graphs and dry information that really eschews the fact that this is an anthropogenic crisis. We know that it is human caused. And yet, where are the behavioralists at the table when we're talking about solutions, when we're talking about galvanizing people to lean in and value this and cause behavior change in their own lives or that of their communities? So I personally have really dug into the psychological angle because it helps us understand things that got us into this mess, right? Our enormous propensity for denial and to protect ourselves in unconscious ways from anxiety and pain, which allows us to maintain the status quo of the fossil fuel system at the expense of the future becoming terrifying, right? But we need to be able to work with people who understand, the psychoanalysts who understand that big ocean of denial that lives within us that has really caused the predatory delay on this issue for so long, or at least stoke the fire of it, so to speak. And we need to be able to talk on levels that are about heart, about what people care about. People care about life, right? They don't care about climate change. And so being able to tap into it through those kinds of stories that really activate that meaning-making machine within us, far more powerful than keeping it only within the realm of science. Not that that's not important, it absolutely needs to be there, it needs to set the stage, and we need to be working from good information about planetary boundaries that are invading our life support system. But the way that we get people to move and grow people power amongst ourselves is to tap into those much more relatable stories that are affecting the social and environmental determinants of our health, things that affect our. So that's why I really focus on vulnerability in my approach, which is in mental health stories. There's a lot about vulnerability people are living with, but it's not just about the deficit of mental illness. It's also about what is holding us back from flourishing. What are the ways in which we can envision better futures and get into emotions essentially? Where are the connections for joy, for meaning, for purpose, for love? And the fact that people are feeling so much anxiety right now because they're compassionate, they care for what they're at, or why there's even such a construct of climate grief. We don't grieve for that which we don't love. So being able to identify those things and bring them to the storytelling space.
Any, Jill, want to jump in?
Just want to add quickly on this, that this is something that I really think is the most important question of how are we going to effectively communicate on climate change? Because if we don't have an answer to that, I don't know what's going to happen. Like that's about everything I write about, like climate. I'm always thinking about that. And I think, one of the things I'm glad to see is that there is more climate change coverage generally, but it's not centered. Not centered. If you put on any newscast, listen to any, read the front page of any, front page, the web page or whatever, It's not leading. So it is a thing that impacts all of us and is the most, I think, most important story is I always imagine a newscast that leads with a climate story every night. Could you imagine what the conversation would be like nationally? In terms of data, yeah, we know that data, people can't process data, gigatons, whatever. You need the data to substantiate the story, to show the delta, where we're going, where we're coming, how big is this problem actually? Whoever said this about sample size, that's a really important thing to educate people about how to understand that. But and I think that the third thing we have to think about is how do we depoliticize this topic, right? I mean, the fact that this has become one of those team sport topics, I think is really consequential. And John Krosnick and the Department of Communication has a lot of research on that if you want to check it out. And finally, again, coming back to the local news angle that was brought up before, that's really important. I think those stories cumulatively could have more of an impact. If you're doing the story on the hunters in Montana and how they're seeing the changes in the wildlife with changing climate, find a way in with your storytelling. So if your research here is about something, find a local angle and get it in local news. It's not only about the Washington Post and the national news outlets. I don't know if we're going to get to this conversation of where to place your stuff, and I know this is probably something you think about, but hitting those because local news is the most trusted too, way more trusted than the New York Times, or CNN.
Other questions? Back in the back.
Someone else? I got local ABC in the house. Local ABC in the house.
I guess, yeah, somewhat similar to the climate change one. I mean, my background's in global health, and I'm on but it's always hard to reconcile the ethics, I think, of scale, for, let's say, just for example, climate change. I think for a personal person to understand the scale of what's possible with climate change is so difficult. But also when you talk about 50 million people being on the most emergency edge of starvation, I think people just turn that off.
Yeah.
And then, and I was doing some public, the pandemic, I also find it interesting. We're not post-pandemic. I mean,
No.
The pandemic is still going on. And so, I mean, there's always, and then also the different countries in the world are in different stages of the pandemic. There's still so many countries who their doctors and nurses have never even received vaccines, where we're on like our 6th, 7th shot, bivalent. And so I find a lot of ethical conundrums with my own work, with myself, and then with my classmates at my public health program. And we did our social determinants of health project on obesity in America, in the Bay Area. And we didn't even mention starvation in other countries. And I think there's relations there. But I understand that, like pointing fingers or like ranting and raving doesn't gain you support. And a lot of people tune it out for good reason. It's just psychologically too difficult to imagine all that suffering. But I wonder, how do you reconcile these large scale problems in our relative privilege? And this was a talk that was advertised as global impact on health. Primarily, we talked about America. And that bothers me, in all honesty. Like, we're I forget, 5% of the world's population? And I don't know, how are we going to, we just are still in the middle of a global pandemic. And if we don't globally deal with health, we're going to keep dealing with these global problems. And our health schools are not necessarily, they're funded by the NIH, which is political and administrative costs and all sorts of things. Like, how are we going to actually shift to a global view to actually right-size the risks? Is my question.
I totally appreciate you saying that, because I 100% agree. And for not wanting to be too pessimistic, I unfortunately feel like we have so many competing special interests within various industries who are not looking at things from a global perspective. The fact of the matter is that there are people out there who believe that because the WHO and today the CDC have lifted emergency declaration that coronavirus, SARS-CoV-2 is no longer a huge issue, when in reality, there is no emergency declaration for malaria, which kills 500,000 people a year. And the perspective is completely lost until people figure out how it affects them. That drives me insane. I wish if someone were to put in a corner and say you have to pick one topic, go for it. I won't pick climate change. It's childhood malnutrition. I can't get people to care, no matter what I do. My very first media project was with human trafficking. Couldn't get people to care until we started profiling pictures of middle-class Americans who have been trafficked. Then all of a sudden people said, oh my gosh, it happened to me. So when we find the needle between global health stories and explain how zoonotic disease can jump on a flight, or how this one population in Northeast was able to get polio, all of a sudden we get people. And it's not a game that I wish we didn't have to do that. I wish people woke up in the morning and said, what's happening in the world affects all of us. People don't think that way. People don't care about rhinos until they go to the zoo and there isn't one. And once we actually find a way to do that, and you first mentioned climate change, it would be amazing. We constantly tell people our planet's dying, but instead we say, hey, guess what? You know why the allergy season is longer? Why plants are moving farther north and why the freeze cycle is actually shorter? It's because of climate change. And then they selfishly think, oh my gosh, my allergies are terrible. Maybe climate change is real. And so I think we start from that place. And again, I'm by no means an expert in global health communication, but from my experience, that's what I found can reach people who don't want to think about anything outside of their bubble.
Let me add, thank you for that. Thank you for that question, because that hits the nail on the head in terms of just perspective, right? How do we have a global perspective on issues that are so intensely local and personal? And yet, how do you kind of go back and forth? If anything, the pandemic, that's still, to your point, like it's still made this world just so much smaller. In the past 3 years, we are so much more aware of, global health immediately impacted every single person. Like no one was not affected. No one was spared. And so I think as we talk about outcomes of the pandemic, as if it's over, or as we talk about solutions that were in place, so much of what happened in New York also worked in Bangladesh. It's like, for once, we actually have one shared experience in a way that we just haven't had when we're talking about other global health issues. And I think there is something there in terms of storytelling from a global health standpoint that is still waiting to be, like, we're just getting started. So I think there's that.
The WHO would say find your SOCO. So a SOCO is your single overarching communication objective. What do you want to do? What are you trying to accomplish? And I love your question. Thank you so much for it. What I was talking about being local is, that's true whether it's where I grew up or whether that's in rural Lao. Is the language appropriate to be Lao? Is it appropriate to be Hmong? Is it appropriate to be Akha? What sorts of things should be depicted? What things shouldn't? What images are okay? What things provoke empathy versus are things that might anger someone? The same image can have very different responses in different places. And those are all important to think about whenever you're trying to do something. It's hard to find a message that is universal. Trying to figure out what is the purpose, what is the point, and then how to focus where you're wanting to work, who you are working with, who are your partners. Thinking about the pandemic, thinking about how many places pulled out from wherever they had been. Were their partners then fully successful and had been supported in a way where they could continue to thrive on their own? Or were they left hanging? Those are very different outcomes from the same action. At the same time, I also want to think about things like climate change. Who are the biggest drivers of climate change? There was no one I met in Uganda or Tanzania or Laos or Thailand who had any doubt about whether climate change existed. They saw it every day and they knew who they blamed. And so trying to talk to people who are wealthy enough to be able to ignore climate change, that have the power to be able to change it more so than anyone else, that's still global, even if it happens in the US.
I have one thought. It's basically been my life's mission to tell global stories as a foreign correspondent, and I teach foreign correspondence here at Stanford. And the goal of the class is how do we tell underreported stories from abroad using all the storytelling tools available to us, whether that be video, narrative, podcasts, TikToks, whatever. The students can do whatever they want. And we start out by reading sort of academic literature about compassion fatigue. What are the tools for overcoming compassion fatigue? And one of them has been alluded to as sort of the identifiable victim. And there's research that shows that we we can't even process two people. We need one single character. So we teach a lot. I teach a lot of single character narrative. And you know that story when you read the single character narrative, which then opens you up to understanding the problem. And so I think, apropos something I think Alok said was, the first two sets of stories that I assign in my class, one is about starvation in Venezuela, and the next one's about starvation in Yemen. And we talked to the reporters who went out and did these stories and how they dealt with it, and the kind of angst I think I'm hearing from you, and what's the impact of these stories. And I think the only way to have impact on global health is to do it one story at a time and show people through your good storytelling, the right character selection, the right data, the right amount, not too much, don't hit them over the head with data, get it in front of the policymakers. And then one of the conversations that we have, and I think it's relevant today, is, okay, well, do I need that mom in Ohio to read that story about Liberia? Does that relate to her? You know what? In the not post-pandemic, the continuing pandemic world, I think one thing we've learned is that we're all interconnected. And so yes, it does impact you, mom in Ohio. And I'm going to show you in my storytelling why you should care about this. Maybe you need to get on the horn and call your congressperson, right? So I think that but where I frustrated is, again, there's not enough focus on these international issues in general, and especially when it comes to global health. So we still have a challenge there, I think, more coverage.
You back?
I just make a comment about our media fellowship, which is CNN fellowship. The fellow spends some time with CNN. The purpose is we really wanted them to pitch global stories. And CNN itself does not want to do that.
Yeah.
So they spent a lot of their time on
Janelle's here.
domestic
Janelle,
stories.
we have one here. Janelle's here.
Yeah, and the CNN, yeah.
From the ABC.
Am I right, Janelle?
Yeah.
I mean, just like human interest stories are on Ukraine versus Israel. 5 million people.
Yeah,
Yes.
the scope is not there yet.
It was just unreal.
There's no correlation at all. Research at UC Davis I can send you between the scope of a humanitarian disaster and the amount of coverage it gets. It's quantifiable easily.
Where's the money going?
The back?
Hi, I'm Sundar. My question is from Alok and me. We can translate maybe instructions for tailors or something with AI and chat. But can how can public health communication professionals ensure that AI, chat, and other language models are designed and implemented in a way that are actually culturally sensitive and linguistically appropriate and inclusive of diverse perspectives and experiences, and in order to promote more health equity and reduce disparities in the health outcomes?
We can't yet.
Take the mic.
Oh yeah, sorry. As of right now, I don't believe we can. I think that's why AI is serving, ChatGPT, the example you gave, is serving as a tool to give us the content that then requires an actual human to go in there and say, I understand this language, I know this population, let me actually make sure this does have the cultural competency. Where there's some hope are in 2 studies from the last month. One of them showed that if you blind people and you don't tell them where the information is coming from, between ChatGPT and a physician, and you describe the course of an illness or a diagnosis, that ChatGPT's answers were rated as more empathetic simply because they were longer and more complete. And that speaks to the fact that physicians just don't have time to sit down and explain everything about asthma. Another one came in the fact that if you ask ChatGPT a pointed medical question, so not why do I have chest pain, but what is the 5-year prognosis for stage 2 breast cancer, and it was rated to be relatively accurate. So I think if we start at a place where we view it as a tool and not as a solution, and then get the human in there to say, I'm going to make this culturally competent, that's a recipe for success as of right now.
Thank you, everyone. Thank you to the panel for a great conversation. Thank you all for showing up. We're now going to go into the next phase, which is about actually writing and placing op-eds. Cecilia, do you want to close with just telling people about your office and how they can access it?
Thanks, happy to. We are here at your service. So the Office of Communications for Stanford Medicine, you're here to tell your stories, partner with. I'm happy to send Jamie knows how to reach us.
We'll send you all of the ways that you can find us. We manage, our social media platforms as well as our youth center, the Scope blog, Stanford Medicine Magazine. But some of these own channels that really are there to tell the best of Stanford Medicine stories. And these are your stories. So we work with some of you as you get papers published, as you have anything that's newsworthy and noteworthy, please come to us and we are happy to.
And to partner a local approach, we also have an anchor in Nairobi here.
Oh, wow.
And also the new comms person for Women's Health. If you want to make a few comments. Give a perspective.
Ooh,
from the
yeah.
global. Yeah.
Thank you so much, Michelle, and thank you so much for such an insightful session. Rock. I think I just had two comments and just one question to any of you. Just commenting from what he said, I think the pandemic brought to the fore the inequalities and inequity that exist, and the issue and the flaws are within the international health guidelines, which have been reviewed to ensure that Africa's CDC, for instance, becomes an autonomous organization that can declare a pandemic or a health emergency. It doesn't have to be when somebody is impacted in the US or an emergency. I think my other comment is I couldn't agree more with you, Dr. Patel, in terms of the initial communication from WHO was completely flawed in terms of how to respond to the pandemic. Being in science communication, it was really challenging for somebody from Sub-Saharan Africa and other lower middle income countries, like for instance, India, the informal settlement, where we are saying put on masks, wash your hands with running water and soap, 20 seconds, and keep distance, social distance. Well, in actual sense, a lot of these people in informal settlements live 2 centimeters away from each other, don't have money for food, they cannot afford sanitizers, etc. So I feel like in future, it has to, we have to tailor make this communication to also suit audiences that have a lot of vulnerabilities and challenges, because this kind of communication actually costed life in Sub-Saharan Africa. There were people who were killed in the streets because they didn't have a mask on, or because they were not social distancing, or during the lockdown they were found outside. Like there's a really sad case in South Africa where a pregnant mother was killed because she was outside and she was seeking health facility. So that communication really costs lives. I don't think people understand the power of communication. I think my last comment, which is a question, is how to deal with the most challenging bit with differences in opinion, particularly from health experts. I know one of the things to filter that Dr. Christina did mention was who's peer reviewed and who's not. But then if they're all peer reviewed and giving information, thank you so much. This was really great.
Thank you.
You should just drop the mic after that.
I agree. Excellent question. And I'm sort of terrified to follow what you just said. Thank you very much for coming and for speaking. Highly appreciate it. And one of the things I always get back to is what does the overwhelming scientific evidence state? Not just one expert's opinion versus another. It doesn't have to be binary. What is the overall assessment? And that's something that hopefully a good science or health journalist will be able to wrap their head around and share that sort of nuance about this is something that really is uncertain and divided, or this is something that really isn't. This person just is a whack job. There's a lot of difference. So just two opinions that can mean a lot of difference.
Do you want to say something, Cecilia?
Oh, good.
No, I was just going to say we're going to start our next session in 5 minutes. So if there are other questions, we can keep it going. But if not, we take a break.
Thank you, everyone.